It's also my pleasure to welcome you all. Bienvenue à toutes et à tous. Since we have today a busy schedule, I will be, or try to be, very brief. As you heard, at the heart of this new institute, there is the objective to serve patients by accelerating life sciences innovation, by providing governance for the trustworthy use and reuse of health data. And for using and reusing health data in a new environment or ecosystem, governance is indeed needed. Governance to address, as Deepak mentioned, legal issues, ethical issues, privacy protection issues, data quality issues, and so on. Quality labeling of the health and other data from different kinds of sources, and today we will focus on data coming out of hospitals and clinical data warehouses and electronic health records. But of course there will be other sources, the disease registries, the primary care settings with their data, and also even data through apps from citizens and patients in the future. So quality labeling of those health data is very important, and the same holds for certification of supporting services within that ecosystem, like for instance the services through the Insight platform, which will be explained later during the day. Sustainability and governance became already very early in the project of EHR4CR, Electronic Health Records for Clinical Research, of the IMI program. IMI stands for Innovative Medicines Initiative, and we have the pleasure that the second keynote speaker is Pierre Mulin, who is the executive director of IMI. Well, these things like sustainability and governance were evident priorities from the very beginning. And this new institute is indeed a not-for-profit organization, is truly European, but I would like to re-emphasize points or conditions that need to be met in order to organize governance and to ensure trust in the whole system. The first is that the organization needs to have credibility, and such credibility or authority can only be obtained through excellence and expertise at all levels, be it executive board, be it advisory board, be it working groups working on interoperability or reuse of data, and so on. Second, the Institute must be able to formally represent all relevant stakeholder categories, and as you know, in our articles of association, we have defined 10 different stakeholder categories, amongst which not only pharma, but also patient organizations, ICT vendors, healthcare authorities, and so on. And the third condition to be successful is perhaps the most important one: being independent and thus neutral. All stakeholder groups have their interest in such a new ecosystem, but it is crucial to avoid conflicts of interest and to prevent that users become captive. Only when these three conditions are met, we will get the so much needed trust. I remember having been involved in another international conference in Brussels already more than 6 years ago, where we planned use and reuse of health data, and which was the main topic of that conference. In the meantime, things have moved forward. Today, this evolution, which could be disruptive, is real. We now get real about the use of real-world data. Is this an evolution or a revolution? I don't know. But by the way, just because I like history, and this is mere coincidence, I open this parenthesis because I love history. The place where we now are is a historic one. It is in these surroundings that the French Revolution interlude, starting in 1789, took a start when the Bastille was stormed and destroyed, and a number of famous persons who formed clubs like Club des Jacobins, Club des Cordeliers, etc. And also the Patriotic Women's Club, who were meeting in the church, etc. But people like Danton, Marat, who was, by the way, a physician, they all lived in the street École de la Médecine here. So I think this is mere coincidence, I think. More recently, we also had here in Paris the November 2015 terrorist attacks. And it was just then that we had to choose a venue for this conference. And it was without any hesitation that we have chosen Paris, not only for the matter of solidarity, but also because we share in Europe often the same values. Now a few words in French, if you permit me. Nous voulions mettre la France à l'honneur, et nous avions bien naturellement aussi d'autres bonnes raisons pour organiser le tout ici à Paris, chez nos partenaires français dans le projet. Donc, entre autres, INSERM et la PHP, l'Assistance publique Hôpitaux de Paris. Et je profite au passage pour remercier et Christelle Daniel et Marie-Christine Joland de nous avoir aidés dans l'organisation de cet événement. Bien sûr, l'assistance publique et les hôpitaux de Paris représentent pour nous tous une importante référence en Europe. Et je tiens aussi à remercier les firmes Sanofi, les partenaires FPA, mais surtout donc Sanofi et AstraZeneca pour le soutien qu'ils ont apporté à cette conférence. J'ai maintenant le plaisir, it's now my pleasure to introduce our first keynote speaker, Gaël Rimbaud, from the French Ministry of Health, a member of the so-called Groupe de la Performance Hospitalière and in charge of innovation in health. And the title of his presentation will be around the importance of big data for public health regulation. So, Monsieur Rimbaud, je vous cède volontiers la parole.